Now, for the general management of protozoans, general management is it clear? Generally, we need to know that protozoans can be treated by three major classes of medication. The first class of medication that are going to treat protozoans are the artemisinin, is it clear, slash the quinines, is it clear? So those are one class that can treat the protozoans. The second class that can treat the protozoans is a sulfametazole trimethoprim, is it clear? Trimethoprim, is it clear? So that's the second class that can treat it. The third class that can treat so you have sulfametazole trimethoprim. The third class that can treat, we have the nitroimidazoles, is it clear? Nitroimidazoles. Example is metronidazole. You have secnidazole. You have tinidazole. Is it clear? The nitroimidazole. So those are the three major classes which are involved with treatment of parasitic infections, is it clear? Now, so those are the three major classes. So every time you have protozoan infection, the three major class of medication that you have to think of are these three, is it clear? So those are the general management for protozoans. Now, the specific management for protozoans now is involved now that we move now to see them. We need to know that for Plasmodium, we had different Plasmodium species. We have the Plasmodium falciparum. Generally, Plasmodium falciparum is going to be treated by, all the Plasmodium is going to be treated by artemisinin combination and is going to be treated by quinines. Is it clear? Quinines and artemisinin combination. I've also forgotten to say that another major medication, general medication that can be used in the management of protozoans, you have chloramphenicol, is it clear? Chloramphenicol. So chloramphenicol, and you have also clarithromycin, is it clear? So clarithromycin, a macrolide. So we can talk about macrolides, which are general macrolides, which are other management, particularly macrolides, which are other medication which can be used in the management of protozoans. So those are the four major classes: artemisinin and quinine, sulfametazole trimethoprim, nitroimidazole, clarithromycin, and the last one is chloramphenicol. So now you need to know that what. Let's come back to the protozoan infection. So you need to know that Plasmodium, you can treat it with either artemisinin combination, or you can have quinine with clarithromycin, which is a macrolide. So those are the three medications. But you need to know that what, particularly for ovale and vivax, which causes relapsing fever, to kill these hypnozoids, you need inside the quinine preparations. Is it clear? To kill the ovale and the vivax, you need the quinine preparation. Like we have the piperaquine, is it clear? The piperaquine preparation. This one are going to kill the ovale and the vivax. But the artemisinin is going to kill all the trophozoids. But to kill the hypnozoid particularly, you are going to need the quinine preparation like the piperaquine. Now, the other ones you are going to have is Giardia. Giardia is going to be treated much more by the nitroimidazoles like metronidazole. We have Trypanosoma gambiense. It's going to still be treated by those three medications. We have sulfametazole trimethoprim. We are going to have quinines, and we have also the macrolides. You can use them. For Trichomonas is best used that you use nitroimidazole for Trichomonas. For Giardia, the best is nitroimidazole. For Cryptococcus neoformans, the Isospora and the Cyclospora, these are major infections which are associated with chronic diarrhea in an immunosuppressed patient. So if you have a patient that has chronic diarrhea, immunosuppressed, you think of Cyclospora, Cryptosporidium, and then you also think of Isospora. It is not Cryptococcus, please. It is Cryptosporidium. Is it Cryptosporidium? So you think of Isospora, Cryptosporidium, and Cyclospora. You need to know that what the major medication is in the treatment of Cryptosporidium. We are going to have use sulfametazole trimethoprim. Is it clear? So you can use sulfamethoxazole, trimethoprim, and there's another medication that I'm going to send to you on the comments in order for you to know it better. So you use sulfamethoxazole, trimethoprim as general medication. For schistosomiasis, we have all the medication that I've just said inside the normal class. Now the other ones, now we have entamoeba, which is still used. Entamoeba medication, when you want to use entamoeba medication, is divided into systemic treatment of entamoeba and the local treatment of entamoeba. The systemic treatment of entamoeba, you're going to use the nitroimidazoles like metronidazole, while for the local treatment of the entamoeba, you're instead going to use the one that are going to kill the luminal entamoebas, like the deloxanide furoate. Is it clear? You have the deloxanide furoate is one of the examples. Is it clear? So those are the general things that you have to know here. Now the next thing after that, we are now going to speak about the class of medication that are going to target the worms.